Welcome to Germany, a documentary hosted by
Ha
and Elle.
Germany is a wonderful place to live in and to visit.
It is located east of London, south of Sweden, and north of Africa. Germany is a very civilized country with a literacy rate of 99%.
Although they are a well-developed country full of manufacturing, history, and culture, they still have some major issues.
They have flooding, air pollution, damaged forests, and hazardous waste disposal, but their major problems include their health.
The Germans' health shouldn't seem too terrible with their life expectancy being 12.69 years above the world average at 79.69 years, but many are still suffering.
As the population grows within the region, more rising diseases, reactions, and/or illnesses due to the Germans' health problems and lifestyle has been rising. Health issues include obesity, tobacco use, alcoholism, allergic reactions to important medications, and much more.
It was said to be from transition within the region, as said accordingly by a tale of two Germanys. Health problems in Eastern Germany are clearly related to transitions.
They have adapted to the healthcare of West Germany due to the cause of no reconstructing of their healthcare, which in many years had caused some dysfunctions.
Based on these healthcare funds, it had included alcohol diseases, obesity, and many other healthcare diseases.
The German population is suffering from multiple health issues, and one important one is obesity. Obesity is a major epidemic, and Germany is a part of it. Over 1 billion people worldwide are affected, and 300 million of those are clinically obese. It is defined as having body weight much greater than what is considered healthy, adults that have a BMI over 30, or if you are more than 100 pounds over your healthy zone, you are considered morbidly obese. The disease affects people of all ages and causes an array of other illnesses. It can result in multiple cardiovascular diseases, type 2 diabetes, high cholesterol, triglycerides and blood pressure, multiple cancers, respiratory problems, or strokes. It is the cause of 2.5 million preventable deaths worldwide and is the second to tobacco for the leading cause of preventable deaths. Morbid obesity is affecting 1 in every 40 Europeans, making it a very serious and prevalent disease in both developed and undeveloped countries. Germany is said to be the holder of the highest population of overweight people in Europe. A regular German does not eat many fruit and vegetables. Instead, they tend to consume a diet rich in fats, carbohydrates, and sugar. The cliché of German beer consumption isn't just a myth. It is believed that beer is one of the leading causes of obesity in Germany. Children in Germany are also affected by obesity due to lack of exercise and poor diets. Obesity is not only affecting the people's weights, but also their wallets. Germany is spending over 90 million a year on obesity-related problems. Poor diets and lack of exercise have caused many problems for countries all over the world, and Germany is starting to take a stand to it for their own people. They are starting a new plan called Fit Instead of Fat, which their goal is to improve the food served in schools and hospitals and increase the level of physical activity in their children. German healthcare providers, politicians, scientists, and food industries are all cooperating together to make this happen so they can better educate their population about healthy eating and physical activity and reduce the amount of advertising junk food aimed at children. They are aiming their goals to help the younger generation of Germans so they can improve the health of their future leaders. Germany is on its way to cut back the obesity in their country greatly by the year 2020 with their new plan. But like on other countries, they must not only focus on the prevention, but also the treatment. If obese-ridden countries take into effect a plan like Germany's to prevent obesity for future generations, but also include a procedure to treat the part of the population that is already obese, then they may be able to expel obesity from a large portion of the country.
Germany's people have been suffering since 2008 from a series of medication called heparin, which is a drug that is used for thinning the blood within the bloodstream. This drug is dangerous to the health of many people because it can cause a severe allergic reaction. Reactions to heparin may include nausea, vomiting, shock, excessive sweating, difficulty breathing, and falling blood pressure. It is crucial for the health issue within Germany because if the citizens are in need of reducing their thickened blood, which is caused by a disease or an illness, they are more prone to be receiving the allergic reactions. Imagine if you need a medication that is high in advanced technology and reasoning in the medical field, but yet you can't use it due to the allergic reactions it causes to people. It makes you wonder why the FDA, the Food and Drug Administration, approves the product to be sold and displayed within stores, because only certain people are able to use it without a risk of an allergic reaction. This can be a problem within the substantial components of the drug, or maybe the line of genetics through the nation of Germany. The FDA also said that they are certain that within the components of the drug there is a fake ingredient. There was also a similar case that was within the US also, which proves that the reaction does not relate to the genetic code of the German bloodline. The product heparin is an imitation of an expensive market of drugs. It was not only easier to obtain, but in fact it was much cheaper than the leading brand produced by the Illinois-based Baxter Healthcare Corporation of heparin. What did they do about it? Well, for starters, they have resulted in tests from 1 through 29 substantial components within the ingredients of heparin. They have determined the factors of the ingredients due to these tests. But also the German authorities did trace back to 2 companies that had produced these products of the imitation in the substance. Although through the cases, investigators still believe the ingredients in the product is still not the main point, but it may be traced back to something else. What should be done about the cases involving the imitation of heparin is to follow up on the cases of the affected patients. They should also observe the analysis of the aspects within the contaminated components and stop all the ports of the companies that produce the products. It will prevent the further increase of patients with the cases of severe allergic reactions.